Rochelle Schultz, CEO of Winona Health, here again on another topic that I wanted to dive into a little deeper. And this particular topic is on testing for COVID-19. So I've done other talks about testing in the past, and there have been a number of changes since those talks happened. So I wanted to bring you up to speed on what is our sort of current state, if you will. So we are doing testing. I think there have been various news stories out there or other information that has been provided to the community about testing. And we have been very fortunate to actually see an increase in our ability to access testing kits to be able to do a lot more testing across the community. So where we actually started with expanding our testing, besides the criteria that expanded through the state, through MDH, is to look at all of our area congregate living facilities. And actually we've been in the process of doing testing of all the residents and the staff of the congregate living facilities in our region, in our service area, probably about a week and a half or 2 weeks ago. And probably about another week and a half to go to get the rest of these facilities completed. And you may have seen in the news where the governor and the Minnesota Department of Health just recently came out in this last week saying that they wanted to expand significantly testing, of long-term care facilities in particular, and other sort of congregate living facilities in the state. So the state is starting that same process, if you will, kind of in other regions. And what's nice is we're a little ahead of that game and almost done with that. As part of that testing, we're also going through and testing everybody, here at Winona Health. As healthcare workers and individuals that are interacting, with patients and community members, we also want to make sure that our healthcare workers are safe and protected, and we have that knowledge, and we make sure then, by extension, we're protecting our community members and patients who are coming here. So that's all kind of happening in the next week and a half, where we'll get all of those things completed. Now, meanwhile, we're continuing to do testing for anybody who comes in. If you have symptoms, absolutely, you can come into urgent care where people have been showing up and having an assessment done and getting that testing done as well. But we also have a lot of folks that are coming in and very interested in getting testing, to understand if whether or not they had been exposed prior or maybe even had COVID a couple months ago when we were unable to do the testing because the supplies weren't available. So we're seeing that happen as well. So I just want to spend a moment. We have two tests. You're probably familiar with these. One is called a PCR test, or this is the swab test. You either do a nasal swab or a throat swab. And we, have to go with whatever kind of swab we get in terms of the kits that we have. So that isn't always a choice that people get to make. But that's the PCR test that tells you, are you currently infected, with the COVID virus or not? So that's like a positive, negative in that regard. The second test is the serology test, or the IgG test. This is the one that tells you whether or not you have antibodies, and that test will come back again, positive, negative, and there's an important issue for that one is the timing of that test. So let's say you have symptoms, of COVID, and you come in and you're positive, for PCR. It will take your body a period of time to actually kind of convert into having those antibodies. So if you do it too early, it may not be a reliable test. It's sort of later on that it becomes reliable. So this is probably the one that we're seeing a lot of folks in the region coming in and asking for, because they thought, I might have had COVID back in February or early March or something like that, and requesting the serology test. If you're interested, what we are posting on our website, if you go to the winonahealth.org website, there's a box that will pop up, and it's got some different buttons on it. There's one called Daily Testing, and so if you click on that, you're going to see sort of a summary of the testing that we've been doing here, at Winona Health for both PCR as well as serology. It'll tell you how many tests we've done, how many have come back positive, how many have come back negative. And then there's some outstanding tests. There's a little bit of a lag time for the turnaround of some of those. Now, that's Winona County. It's also surrounding counties, and it does include people who have been coming over from Wisconsin, for testing. So those numbers eventually are not really adding up to the same as what you might see on the MDH website that talks about like Winona County specifically in terms of positives or some of that type of information. So when we do the testing, just so that you're aware, the results when those come back we have our nurses on our nurse line who are calling patients and letting them know what their test results are and answering any questions at that point. We also have, just on the website I mentioned, there's actually 2 links on there that you could certainly pull up. You could download. We will also have those same handouts available here on site. One is an algorithm that I think you should take a look at. It talks about each of the tests. What is a serology test? What does it tell you? What is a PCR test? What does it tell you? And has some really good information on those so that you're really informed about the decision that you're making in terms of which test you're going to do or both, or how do you really look at what these results mean. And then there's also a frequently asked questions document. And so we've been collecting those questions that people have been asking and putting responses down. So I think that's a really good document also to take a look at. Hopefully that answers all of your questions. If not, again, you can call those into our nurse line or email them in. We want to make sure we have a good, complete, frequently asked questions, for everybody around this. In terms of insurance and cost of these tests, what we do know on the PCR tests, the swab tests, basically all insurances cover that without any copay or deductible. That was kind of determined, I don't know, probably a couple months ago with the advent of all of the COVID, situation coming on, and really all insurances are doing that. The serology test might be one that you want to contact with your insurance prior to coming in. So that one is maybe in a little bit of a different situation. Some are covering it, some of them we don't know yet. We maybe haven't had some of those insurances. So that you might just contact your carrier and ask those questions. Our typical turnaround time, with the serology test is about 24 hours or so. So that's a pretty rapid one. The PCR test, the swab tests now are taking about 3 days, so 48 to 72 hours. And I think that's a function of us doing a lot more testing, right now too, and needing those to, get run through the lab. So volume does make a difference in being able to get that turnaround time, fast. But as soon as we have those results, we are getting them out, quite quickly. Keep in mind that if there's any positive PCR test, any positive swab test, those are reported to the Minnesota Department of Health. That's a requirement. And the Minnesota Department of Health will be following up with any person who has a positive test to do what is called contact tracing. So they want to investigate who has that person been in contact with and potentially where, that virus could have been spread. So, that's operated, by them. That isn't operated by us, but we are required to report, or the labs are required to report any positive tests that come in. Our locations continue to be our urgent care. You can come in here and get the tests done. If you're coming in just for a serology, you can just come in through the clinic entrance, and we have people just going right in directly to the lab, for that. And so those options are available to you, as well as Rushford. We have, the Rushford Clinic is another location where we're doing some of the testing. So if you have any other questions, if something comes up about your testing that you have questions about, your primary care provider is also a really great, resource. And, our clinics are open. Our providers, are ready. We've been, bringing patients back, and so you are welcome, also to make an appointment with, one of the primary care providers to go over any of your results. So with that, I think, this is, we feel really good about being able to expand the testing as much as we have been able to. I think it's going to give us a really good sense of our community, what's the prevalence in our community, how much has maybe been here that we didn't know, and all of this is just going to be a lot of really great information for all of us to continue to make sure that we're all safe, that we're keeping each other safe, and we're really doing the right kinds of things in our community to limit the spread of this virus. So thank you for your time.